This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hello.
Hello.
Welcome back. My name is Yvy.
I'm Julie.
And today we're going to be talking about varicella.
Chickenpox.
Yes. Did you have chickenpox?
I had the shot.
Oh, okay.
Yeah, so I never got it.
Yeah, I got chickenpox.
How young were you?
I think I remember I was maybe like 6 years old.
Okay.
Yeah, 5 or 6.
All right, because I know that...
But I do remember it. I remember the fevers.
Yeah.
I remember like all the pustules and stuff. I still have scars.
Oh,
Like,
okay.
Scar. Like on my nose. You probably don't see it too much now, but like on my nose, I still have scars from varicella. Yeah.
Oh, man. No, man. I didn't get it. I got the shot, and I mean...
Yeah.
And I've been around chickenpox. I've even been around shingles, and my shot has
Yeah.
held
Yeah,
up. Held up, but...
My older brother gave it to me.
Oof.
Yeah.
Well, I think that's how it happened with Mario too, that his older brother gave it to him. And it's just, I've heard that as a kid, you go through it. Yeah, it sucks. The high fevers, like you said, all that stuff, the pustules. But like that, if you get chickenpox as an adult,
Oh, yeah.
that
Everyone
it's
knows
horrific.
it's horrible.
Oof, I don't wish that on anyone. I've heard horrible, horrible things of that.
Yeah. It's pretty bad. And today we're going to talk about it.
Yeah, let's dive into it.
Yes. So we're going to talk mainly about what varicella, what it is, and just an overview on the vaccine, safety, all of that.
Yeah,
Cool.
let's do it.
All right. Varicella, which is better known as chickenpox, is an acute, highly contagious disease caused by the varicella zoster virus, which is also known as VZV. You might see that on different like medical forms. VZV stands for that. This is a virus that comes from the herpes family, and it's spread almost exclusively among humans. In most children today, it causes a mild illness with an itchy, blistering type of rash and a fever. However, chickenpox can be really serious. The World Health Organization notes it is more severe in adults and can be life-endangering in newborns and immunocompromised people. The virus spreads via respiratory droplets or direct contact with the rash fluid. So those little blisters, if you come in contact there, that's going to be the active virus. And people are contagious from about 1 to 2 days before the rash even appears until all the blisters have crusted. Now, about 90% of unvaccinated household contacts will get infected if exposed, making chickenpox one of the most infectious, common childhood illnesses. Just like what we were kind of like talking about right now. I got it from my brother. And, you know, it's really hard. My mom kind of taking care of my brother and then having to take care of us. After a chickenpox infection, the virus remains latent in nerve cells.
That means that it's like sleeping.
Just sleeping there.
Waiting
It's
to...
there, but it's sleeping. Yeah. And then in roughly 10 to 20% of people, it reactivates years later, which is what is commonly known as shingles, herpes zoster. Okay. Now, chickenpox usually lasts about 4 to 7 days. Early symptoms, which is what we call the prodrome symptoms, often include fever, tiredness, headache, or stomach ache. I mean, we always talk about these like flu-like illnesses.
Yeah, I mean, they're common throughout, across the board.
Exactly.
Yeah.
And it's basically about 1 to 2 days before the rash actually appears. The classic rash then appears as itchy red spots that turn into fluid-filled blisters and eventually scab over. Like this image.
If you're watching on YouTube, obviously.
It often starts on the face and trunk and then can spread over the entire body, including inside the mouth or the eyelids. Yay, so yummy.
Inside the eyelids, my God.
I don't remember inside my eyelids. I specifically remember the ones on my scalp. Like I would pop the blisters.
Oh,
yeah, I remember that. I actually remember the feeling of popping the blisters on my scalp.
Oh my God, that sounds
That was
awful.
disgusting. I was like 6 years old, right?
Well, yeah, I mean, you're a kid. You don't
But
know.
I do remember having in my mouth. That was really rough. I couldn't eat.
No, of course not.
Yeah.
I mean, I feel like that happens also with hand, foot, and mouth.
Yes.
Oh, because that's kiddo had that, and I was like, and then I got it, and I thought I was gonna die.
Yeah.
Like hand, foot, and mouth for adults is like,
Awful. It's awful. It can
holy.
be really awful for a lot of kids
I
too.
felt sicker with hand, foot, and mouth than I did with COVID. Ridiculous. But anyway, like, I mean, eyelid?
Yeah.
Ooh. Something about the eyes. Me and the eyes.
Yeah, I
I
don't like it either.
can't. Oh my God. I cannot imagine a blister in there. My Lord.
It's terrible.
Mm.
So healthy children typically recover without any problems, but the rash may cover the whole entire body in successive crops, so of lesions over several days. And then vaccinated children sometimes get breakthrough varicella, which is a very mild case with few or no blisters and low to no fever. In general, 1 dose of a vaccine is about 80% effective, and 2 doses is about 90% effective at preventing any symptomatic chickenpox. The vaccine prevents nearly all severe cases of it.
Yeah. I don't know, but I don't want blisters behind my eyelids, so no.
Yeah, ew, no.
I'll take the shot.
And also, just like getting it as an adult, it really is
Well,
terrible.
it could land people in the hospital. It's horrible. Alrighty, symptoms and possible complications. Here we go. Most children with chickenpox have a few days of fever and feel unwell, followed by stereotypical rash. The typical symptoms are fever, tiredness, headache, and loss of appetite, beginning at about 1 to 2 days before the rash starts appearing. Possible complications that include bacterial skin infections from scratching, because they're so itchy, and it's just like,
Yeah, just like I just said, like I was a kid, just like popping the blisters, you know?
yeah, yeah. Next one could be like pneumonia, dehydration, blood infections, which aka sepsis, or even brain inflammation, which is encephalitis or cerebellar.
Cerebellar ataxia, yeah.
There we go. Bleeding problems, and in rare cases, even loss of life. For example, pneumonia occurs more often in adults with chickenpox, and encephalitis can happen especially in teens or adults. Pregnant women who get chickenpox can have pregnancy loss or have a baby with congenital varicella symptoms.
This is awful.
Ooh,
Congenital varicella is,
have you ever seen it?
I'm trying to think because we saw a lot of torch infections. I think I had one. I had a couple cases of CMV.
What's that?
Cytomegalovirus. It's just another virus that can cause like a congenital infection is really severe. But I'm pretty sure I did have one congenital varicella.
Oh. Okay. Okay. The risk.
Baby was really sick. I mean, this was an ICU, so
Oof.
yeah.
So the risk of severe disseminated infection is very high in people with weakened T cell immunity. So example, leukemia patients, transplant recipients, or HIV patients. Because of the risk of REY, it's REYE syndrome.
Rye syndrome.
Rye syndrome. I thought it was with, okay, so yeah, okay, Rye syndrome. So aspirin must never be given to a child with chickenpox. Instead, use acetaminophen for fever. The CDC lists groups at highest risk for severe varicella to be including immunocompromised patients, individuals without evidence of prior immunity. That's like we had said, cancer patients, HIV, transplant recipients, that. Then also high risk is pregnant women without immunity. Chickenpox can severely affect mom and fetus. Newborn infants whose mothers develop chickenpox a few days before or after delivery. So these babies lack those protective antibodies. That's why they're high risk. And then of course, premature infants exposed to chickenpox, especially those born before 28 weeks. So people in these categories should seek prompt medical attention if exposed or symptomatic. Otherwise, healthy children and adults can often be managed at home.
Yeah.
Preventing bacterial complications by keeping fingernails short and clean and using calamine lotion, cool baths, maybe using some oatmeal or like a little bit of baking soda, and antihistamines for the itch may help.
Yes. Calamine lotion is such a big,
It's huge.
yeah.
I look at it and it's like chickenpox, and I never even had chickenpox.
I just remember being like slathered on.
I'm sure.
Yeah. And calamine, it's cooling at the same time, and it's just, I don't know, I have like these memories of being like bathed in calamine lotion.
I'm sure. Oh.
But anyways, let's talk about how prevention works for this. So the chickenpox vaccine is going to be the best way of preventing this. The varicella vaccine uses a live weakened form of VZV that safely stimulates immunity without causing the serious disease. Dr. Takahashi in Japan developed this live attenuated vaccine in 1974, and it was the first vaccine ever made against the virus in the herpes family. And after testing it in leukemia and healthy children, the US FDA licensed the vaccine in 1995. So that's why a lot of millennials got varicella, and some of us didn't because we had a chance to be vaccinated.
Exactly. I mean, we were 6 at that time in 95.
So that kind of tracks with what I remember when I remember getting varicella. I think I was like about 6 or 5 years old.
Exactly.
Now, in the US, CDC recommends 2 doses of the varicella vaccine for children rather than older single dose schedules. The first dose is given at 12 to 15 months of age. It's regularly part of that 1-year vaccine, that 1-year cluster of vaccines that we give. And then the second dose is at the age of between 4 to 6. It's that booster dose. It can be given at the same time as other routine shots or combination as the MMRV, or also known as ProQuad vaccine. And again, this is going to be the later age, not the 1-year age. At the 1-year age, we do recommend separating MMR and a separate shot of varicella. Children or adults who miss these shots should be vaccinated later. Everyone who has never had chickenpox or the vaccine is advised to get 2 doses 4 to 8 weeks apart, even after exposure to chickenpox. A vaccine given within 3 to 5 days can often prevent the disease or make it milder. For people who truly cannot vaccinate, like newborns or severely immunocompromised, doctors may use a different antibody treatment. It's very similar to what we talked about with Hep B.
Yep.
Let's jump into the effectiveness and the impact. 2 doses of varicella vaccine are about 90% effective at preventing chickenpox. If a vaccinated person does get breakthrough varicella, which is at 10%, it is nearly always mild, often just a couple red dots, maybe a couple blisters, low fever. But really what we're protecting against is this severe complication.
If you do get that breakthrough, it'll be like a very, very, very mild form of it. Yeah.
Yes, which is usually what we talk about with vaccines in general, right? Even though you're vaccinated, it's not 100%. However, if you do get the disease, it's most likely going to be a mild version of it. And the vaccine greatly reduces both the chance of infection and, again, the severity and complications from that infection. Side effects from the vaccines are usually minor and brief. Common reactions include the soreness of the arms or the legs, I guess, when you're a toddler, or maybe some redness at the injection site, maybe a little bit of a fever because it is a live virus, so you're going to mount a bigger immune response, and occasionally a few pox-like spots or a mild rash can develop, and that is common. This is a lot of people will say, oh, no one ever talks about these complications. And it's actually most pediatricians that I know will talk about the fever, potentially getting a little bit of a rash.
Yeah.
But again, I always encourage patients to ask your doctor, what can I expect? Even if it's a little bit rare, what can I expect? A live vaccine causing a bit of a rash is expected and normal. Now, serious reactions are extremely rare, and high vaccination coverage has made chickenpox really rare too. It's still around.
For sure.
We have seen it. Okay.
For sure.
Now,
I feel like before, when we were kids, there were more of those chickenpox, like
The breakouts.
Exactly.
You know, like when you have a flu and then the classroom, the whole entire class gets the flu.
Exactly. Now, I mean, my kiddo's 7. He's been several years in school, and I haven't had a single, knock on wood, a single one of those. I mean, he's vaccinated too.
Yeah.
But still, we haven't had a single one of those. Yes. And I'm like, man, that's so different from when I was a kid. I remember that was like, pretty common.
Yeah.
At least in my school.
And again, we're not going to see it, kind of like what we talked about in our Hep B vaccine.
I know.
With everything going on with vaccinations and people, vaccine rates going down, we're not going to see it now. It's our kids that may see that.
Yeah.
High vaccination coverage has, did I already say that?
No.
Okay. As the CDC notes, 2 doses of the varicella vaccination led to more than a 97% drop in U.S. cases. So most healthy children can play safely without getting the disease. Today, almost all U.S. children are vaccinated against chickenpox. All 50 states require proof of varicella immunization. for entry of school. That's going to change for Florida. What can I tell you? I'm not proud of my state here.
Is that already set in stone? Or are we
Supposed
still...
to take effect in December? What can I
Oh,
tell you,
for the
girl?
love of Christ.
Yeah. Now, and I'm really afraid for babies, to be honest.
Yeah,
I'm very
yeah.
afraid for babies.
Yeah.
And immunocompromised individuals, but it really sucks. In 2023 to 2024, CDC reported that about 92.4% of kindergartners nationwide had received 2 doses of varicella vaccine, and state by state coverage ranged roughly between 79% to nearly 100%. This is only slightly lower than the 94 to 95% coverage seen before the pandemic. High coverage is needed to achieve herd immunity. When most people are immune, even those who cannot get vaccinated, for example, infants, immunocompromised individuals, they're going to be protected because the virus cannot spread easily. Globally, varicella vaccine adoption varies. As of 2023, only about 23% of countries, which is 45 out of 195, include it in their routine immunization programs. Most African and many Asian and Latin American countries do not vaccinate universally for chickenpox, often considering it a mild childhood illness and prioritizing other diseases. And in nations without routine vaccination, chickenpox remains common, affecting the majority of children by adolescence, whereas places with high vaccine uptake have almost eliminated endemic transmission. And this is, again, we're talking about the availability of certain vaccinations in other countries. Yeah. Just because other countries don't vaccinate doesn't mean that it's bad to vaccinate.
Exactly.
Which I think is like a very common misconception. I don't know if it's just because in my clinic, we got from
like a mix
international.
Yeah.
But I see many parents saying, well, in my country, we don't vaccinate for that.
Uh-huh.
But that doesn't mean that there's we're coming from a bad place vaccinating your kid.
Right.
We have the opportunity to vaccinate.
Yeah.
It's kind of like when a medication is in one place but not FDA approved for like another country. It doesn't mean that medication is bad.
Right.
It just, we don't have it yet.
Exactly.
Right? So that's something that I challenge some maybe international parents to understand, that just because your country does not vaccinate doesn't mean that if someone is offering you the vaccine that it's bad, right?
Yeah. It's just there's such a villainization of it.
Yeah, exactly.
It's just no, and I mean, we're talking, I know if you look at it, a lot of countries that don't vaccinate it is because they can't. Or they're third world or something like that. I mean, if you look at first world countries, a lot of them do. So you gotta look at it in that aspect as well. It might be a more of an economic type of situation for those countries. So it's just, I don't know.
Yep. For example, in a recent outbreak in New York City, 2022 to 2024 occurred primarily among unvaccinated migrants from Central and South America, where varicella vaccine is not routinely given. And in that outbreak, 92% of 873 cases were in people with no vaccines recorded. Now, public health officials quickly administered over 27,000 varicella shots to contain it. This episode underscores that low immunity, whether due to policy, access, or refusal, can let chickenpox reemerge even in today's day.
Yeah, where it's in
today's age, reemerge even today.
I think, you got the point across.
Yeah, I got the point across. Y'all understood me.
Yeah, I mean, that sucks, because I'm sure that, look, it was even an outbreak.
And again, I had chickenpox.
Yeah.
Right? I was lucky that I didn't have any severe complications. But knowing what I know today and the complications of varicella, I could have not been okay.
Yeah.
And I think that's something that a lot of people don't finish that train of thought.
Exactly.
Right?
Yeah.
They stop at, I was okay.
Exactly.
I got through this. Okay, but if you knew all the complications, if you've seen the complications, you should, I think the next part of your thought process should be, but it could have gone south.
They don't get there.
But they don't get there. Yeah.
Absolutely. You're absolutely right. They just don't finish that full train it, and they just don't want to either.
Yeah, and I sometimes feel like they purposely don't do it because they don't want to get there, right?
And it's like, oh, it's negative thinking. No,
it's not negative thinking.
It's truth. It's like, it's the truth, but
yeah, it's like
You're absolutely right.
and it's for anything in life, right?
That's what I'm saying.
If you're gonna sign a contract with someone, it's like if you had a lawyer telling you
100%.
hey, if you did, and then you'd be thankful, you'd be like, knowing what I know, I didn't make that mistake or something. It's like hindsight is 20/20, right? So
Yeah, no, that's exactly it. You sign a contract. A lot of the reasons why you sign contracts is so the worst thing doesn't happen.
exactly.
So it's the same thought process, Anyway, so disease before and after vaccination. A little brief history on it. Just because I feel like when we're talking about these illnesses or diseases or however you want to categorize them, we had talked about it in Hep B. Unfortunately, history tends to repeat itself. So it's nice to look back at how they were and like how it is now. It gives you a really good picture of contrast and like how effective these things are and how science has done such great things, you know? Before 1995, when the vaccine was introduced, at least here in the US, chickenpox was nearly just universal. Almost every child got it at that time and before then. CDC estimates from the early 1990s show more than 4 million cases per year in the US, with about 10,500 to 13,500 hospitalizations and 100 to 150 lives lost annually due to that. Notably, more than 90% of those hospitalizations and about half of the lives lost were children. So chicken loss. We're losing the chickens.
We lost the chickens there for a while with the bird flu.
We freaking did. We definitely did. Thank God that like stopped because I'm like, oh my God, how much more do we need, man?
It was scary there for a second.
Yeah, it really was. We were following a pretty nasty trend there.
Yeah.
Anyway, so chickenpox even caused congenital varicella syndrome in about 40 infants per year. After vaccination began in 1995, incidences plummeted. Over 25 years of the program, cases dropped by over 97%. Now the U.S. sees fewer than 150,000 cases per year. That's roughly 1,400 hospitalizations and about 30 lives lost. Look at the comparison.
Yeah.
A tiny fraction of pre-vaccine levels. So in practical terms, chickenpox now is what you would consider rare in these numbers, right? Yeah. Many pediatricians have gone through training without ever seeing a classic case, like the newer generation now. Isn't that nuts?
I'm like really trying to see like a classic case of chickenpox and maybe one that I saw. And I remember that I had another physician that was older than me look at it to see, and they were kind of like, I actually think that this is chickenpox. Because it's
it's not that common
anymore. Not that common anymore. And you have hand, foot, mouth that could kind of like, that we feel is like more common. And it just like makes me wonder sometimes, like how many times did, I say that it was chicken, like that it was Coxsackie, which is hand, foot, mouth, and it was maybe chickenpox. But again, I usually look at the vaccinations. Like if you're vaccinated, like the chances of you having
chickenpox.
That, and especially also if there's no exposure. So if you're fully vaccinated and I'm here and I think that you really have chickenpox, I'm gonna ask like, where were you? Like exposure wise, But it is really rare, and my colleagues have maybe seen like one case, and it was because like a parent had it and they gave it to the kid.
It's fascinating seeing how like those trends have dramatically changed.
Measles, I've never had a case of measles ever,
and I hate to say that you probably will.
I probably will soon enough,
unfortunately. Oh boy. All right, among today's children, severe complications or loss of life from chickenpox are exceedingly unusual. The vaccine also indirectly reduced shingles cases because again, like she had mentioned, if you had chickenpox, then it'll remain latent or sleeping.
I have
and then
the potential of developing shingles.
Hence, if you haven't gotten it, get the freaking vaccine like I did. I have never gotten it.
I'm so scared of like shingles.
It's nasty, man. Oh, he got
twice,
it.
I think. Yeah.
No, I've seen it. I've seen it through my mom. It's nasty. And I've seen some people.
And it hurts.
Yeah.
It hurts.
Oof. By preventing wild virus circulation, it has, if anything, modestly lowered zoster incidence, which is that.
Is shingles.
Yeah.
When you hear varicella zoster, we're mostly talking about shingles, not like the initial varicella virus.
Okay. And then the varicella vaccine is credited not only with preventing tens of millions of illnesses in the US, but also billions of dollars in healthcare costs, which is like, guys, aren't you guys politicians and like money when, well, I don't.
It doesn't make sense to me. It doesn't make sense
It
to me.
really doesn't. It really doesn't. So yeah, I would get it. Look at those numbers, guys. The numbers don't lie.
Yeah, I'm always afraid. I'm always afraid of shingles.
Yeah. Mostly with like how stressed out
With
you've
stress,
been.
yeah, with the stress, and I'm just waiting.
Oh, no, man. Knock on wood, man. No.
The other day I had like almost like a burning, and it was along a dermatome, and
Oh, no.
in my mind I'm like,
Yeah.
God, I'm like, this is it. I'm like, this is it. It's nothing. I never got a rash or anything, but I still, in the back of my head, was that a little bit of it was going to happen, maybe not. I don't know, but shingles is terrible, and I'm always afraid of getting shingles on my face or something.
Yeah.
I'll
I've
never
heard those horror stories of like the eye.
The eye. I'll never forget. When I was a medical student, I was doing my family medicine rotation. I don't know why this specific patient sticks out to me. She was an older woman, and she had shingles on her neck, but she told me that she was in so much pain because it's like a neuropathy type of pain.
It attacks the nerves.
It burns. Exactly. Yeah. It's like a nerve pain. So it's more of a burning sensation. And she said that she had to wear a scarf because anytime that the wind would blow to her, it would she felt this like pain just up her face completely.
Oh my God.
And I don't know why. I just never, she was in so much pain.
Yeah.
I could see it in her face. She was in so much pain, and we have treatments and stuff that we can use, but that pain is really hard to manage.
Yeah. Oh, thank God.
Let's talk about, now that we're talking about treatments and all that stuff, let's talk about treatment and home care. There really isn't a cure for varicella virus once someone is infected. You have to just kind of get through it, and treatment is basically supportive. For most healthy children and adults, doctors recommend at-home care, keeping the fever down with maybe Tylenol, no aspirin, relieve the itching with calamine lotion, antihistamines, cool baths, and preventing bacterial infections, which is kind of keeping your hands cleaned, nails trimmed, and washing your skin gently. Children usually miss about 5 to 6 days of school or childcare due to chickenpox. Most recover fully as the blisters crust over and heal in about a week. Antiviral medications, for example, commonly acyclovir or valcyclovir, can be prescribed, but are generally reserved for those at higher risk of complications. CDC advises antivirals for people over the age of 12, pregnant women, and anyone with chronic skin or lung disease, and anyone with a weakened immune system. When given very early, ideally within 24 to 72 hours of rash onset, acyclovir can shorten the illness and lessen the severity, and immunoglobulins, which are those antibodies, may also be given to newborns or immunosuppressed patients as a precaution after exposure. Anyone with chickenpox who meets these red flag criteria should seek medical care promptly. After the blisters scab over, chickenpox is no longer contagious. Now, unlike some other live vaccines, the varicella vaccine does not cause shedding of the virus into the air. Vaccinated people do not give chickenpox to others.
Right.
Rarely, children may develop a few pox-like spots from the vaccine strain, but these are weak and not a public health concern. Still have to be careful, because if you do get that rash, you should not be touching it and stuff, just in case. So let's talk about the hesitancy and the misinformation.
Yeah. Despite the vaccine's success, which we had talked about, and it was very, very stark.
Yeah.
Recent years have seen a rise in vaccine hesitancy that can reverse gains, all of these wonderful gains, against many diseases. Misinformation and mistrust are common on social media, as we see day in and day out.
Day in and day out. Whew.
And in some activist circles. The World Health Organization has identified vaccine hesitancy as a top global health threat, warning that reluctance to vaccinate can reverse progress on preventable diseases. Dr. Paul Offit notes that social media-driven myths have led more Americans to decline vaccines for their children as well as for themselves. The U.S. is seeing evidence of this trend.
Yeah, and now it's not just social media. Now it's our administration that is also pushing this.
Which is embarrassing.
It's embarrassing. It's truly embarrassing.
CDC data show that children born during the pandemic, the COVID-19 pandemic, 2020 to 2021, have lower vaccination coverage across the board compared to pre-pandemic cohorts. The way that pandemic changed so much for the worse, it's like the list is never ending. It's changed people's behavior in not only vaccines and vaccinations, but just like in the way people work, in the way that people are even with each other, in the way that people think, everything. That pandemic did so much damage to more than what we even see from the outside right now. We're going to look back at 2020 years from now and see such bad things that came from that one year. It's incredible. And I saw like a creator that had a really, really, really good point the other day. And I was like, honestly, he blew my mind. And it was like the pandemic shifted and totally warped people's minds because it proved to this whole generation of ours, of course, like millennials, Gen X, everybody that's like working out there doing the thing, that our lives are fleeting. Mm-hmm. The pandemic really like put it out there. You could lose your job in a matter of an instant. You could get fired in a matter of an instant, or you may just lose your life in a matter of an instant from like nothing. The pandemic just like really shoved it in people's faces, whether they liked it or not. And that kind of just completely changed people's way of thinking about their lives.
Yeah.
Isn't that fascinating? Yeah. And then now you see like how people are working different schedules or doing different things. And then that's maybe a good thing about it. But like the bad aspect of it is that people then now over question like all these things. And it's just like this pandemic it's such a psychological experiment that was done.
You don't realize like how it could indirectly affect things.
Ooh, like it really did a number in a psychological aspect to everyone that lived through it, you know?
I think about the pandemic, and I didn't have that job situation because I was in healthcare.
It's very different. Yeah.
It was very different for me. Like, but even then, I just think about, just everything. Like, and that was, now going on almost 6 years.
Almost 6 years, yeah.
And I just, the fear, everyone wearing gloves, like getting gas, going to the groceries, restaurants closing, takeout, like just so much. The fear. I remember like all my attendings, like as residents, everyone taking one for the team, like having to do like one check on one patient with one person to limit that, it's crazy.
It truly really messed with everybody's psychology.
Yeah.
It really, really did. It's just, it's crazy the depth, the amount of things that it did. It really messed a lot of things up, honestly, more than just on a health side.
Yeah.
It messed things up on just such a global aspect of everybody's lives and everywhere,
Yeah.
Oh man. Anyway,
we went into like a trauma moment.
Yeah, we all did. We're just like, that was a bomb. Like,
yeah, it's just, I have like very, very specific memories that I don't think like I'm ever going to forget. Like hearing about the first case that was in the United States, and then hearing about the first case in Florida, and where I was. Like, I remember I was on night shift. I remember my attending that was on. I remember what I was wearing. It's those things that are so like etched in.
Yeah, like a snapshot of that moment.
Yeah.
It's kind of like when the towers got hit.
Yes.
It's another
I remember
snapshot.
where I was. Yes, exactly. Yeah, exactly like that. Yep.
Yeah, it's one of those moments like that are just, you cannot erase from your head.
Yep.
Compared to. All right, financial barriers and access issues may play a role, but public health officials point to complacency and misinformation as major factors that must be addressed. For chickenpox specifically, hesitancy often stems from the belief that it is just like, it's a mild rite of passage, like for kids, and it's just not worth vaccinating against.
Yeah.
Some parents prefer the idea, which this actually reminds me of, remember a couple of years ago that people started doing freaking chickenpox parties?
Yeah. I think that is so dumb.
It's so stupid and disgusting.
Yeah, but just like dumb. I don't understand like this whole entire thing on like a chickenpox party was. And I don't think nowadays people even understand that either, because if one kid is sick, I'm just kind of like, look, I love you and everything, but like I really don't want my kid to get sick.
Obviously, but they did it because then they're like, oh, the whole purpose was, it was like the way of getting vaccinated naturally.
Exactly.
And I'm like, no.
Yeah. But then again, like those were like different times back then where we didn't have all this data.
Oh God. But I mean, this one wasn't even that much back then. I remember reading it on the news.
Yeah, like around
Anyway.
early 90s.
Oh boy.
Yeah.
Some parents prefer the idea of natural immunity after infection. This echoes a myth. Better to get the disease than the vaccine. Health experts strongly dispel that. The CDC reminds us that diseases like chickenpox have serious complications, which vaccines avoid. In the U.S. today, virtually all serious chickenpox hospitalizations and lives lost occur in unvaccinated people. According to the CDC, losses of life continue to occur in healthy, unvaccinated children and adults. With vaccination, a child gains immunity without the risk of pneumonia, encephalitis, or other rare severe outcomes. And then, of course, of getting shingles later on in their lives. Other false beliefs sometimes surface. For example, concerns about vaccine ingredients. That one always gets me. Vaccine ingredients or claims that vaccines cause unrelated conditions. These are not specific to chickenpox. Medical authorities in state there is no evidence linking any vaccine to autism, and the aluminum or preservatives in vaccines are at safe doses. And again, go back to like, what episode? I don't even remember. Was it No. Tdap. It was Tdap, where it was about aluminum. It's not the aluminum in the aluminum foil, guys.
So, to me, it's so crazy.
It's like they see aluminum and like, oh, it's the aluminum
Like the
foil.
mercury thing too. Like the mercury things, like methyl mercury, ethyl mercury. It's just,
It's interesting. I'll just say interesting.
yeah.
Or they're in safe doses.
That's
everyone.
another thing now, Trump or whatever, ever since saying like, just get the single shot. And so now apparently like they're trying to make like measles separate from mumps, separate from rubella. And everyone is always concerned about all these ingredients, all that stuff. So if you're adding, right, because you're separating, how make that make sense?
It doesn't. The varicella vaccine itself is very safe. Beyond minor side effects, it has not shown to cause long-term harm. CDC data indicate that the vaccination reduces, not increases, later herpes zoster. The Oka vaccine strain, which is the one used for this vaccine, is much less likely to reactivate shingles than the wild virus. In short, vaccine hesitancy in general, whether about COVID, MMR, or varicella, tends to be driven by misinformation, fear of needles, and distrust of authorities. Listen, I hate needles as much as the next person. I sometimes faint when I have to get blood drawn. I will still rather the vaccine. Thank you.
Yeah.
Thank you very much.
I mean, I get it. No one's trying to belittle like your fear of vaccinating, but there comes a point where you have to be like, it's for, yeah, exactly.
Weigh it out.
Exactly. Weigh out the risks and.
Yeah.
But.
So if everyone assumes someone else will vaccinate, outbreaks will reemerge. You can't really rely on herd immunity to just protect us all. Because if we keep seeing the downturn of vaccination rates, then we won't have herd immunity. The recent resurgence of diseases like measles, for example, is on a 30% global rise in cases.
Yeah.
And it has been attributed in part to this kind of complacency. Health experts urge a balanced view. Vaccines are among the most cost-effective health measures, preventing millions of losses in life annually. And again, this Dr. Offit, which he's an expert in the field, warns in an environment of misinformation, children can be harmed when parents skip vaccines.
Yeah.
In the U.S., small declines in school vaccinations have been documented post-pandemic. In 2023 to 2024, reports show varicella vaccine coverage dropped a bit from about 95% before COVID to about 92.4% now. While medical and non-medical exemptions have crept upward as well, because, I mean, loopholes, and people will overuse them. Public health authorities view these changes with concern. Even a modest fall in coverage can allow outbreaks, especially if unvaccinated people clustered together, like that NYC outbreak that we talked about earlier in this episode.
Yeah.
Only 1.2% of the cases were acquired in schools, mainly because U.S. schools have strict vaccine entry requirements for this same reason.
Yeah.
So in contrast, the outbreak mainly spread in shelters and homes where vaccination was not universal.
Yeah.
So you see right there why those requirements exist, you know, as a perfect example.
Yeah. Now let's address a couple of the myths.
Yeah.
It helps to contrast claims with facts, right? Yeah. Now, one myth says chickenpox is not dangerous, and the reality is that it can be dangerous for infants, adults, and certain medical patients. Another say that vaccines is like kind of like an overload to the immune system or contains toxins, and in truth, the antigens in the chickenpox shot are a tiny fraction of what the children's immune systems actually handle daily, and the ingredients are safe at the doses used. You are far more likely to be seriously injured by a vaccine preventable disease than by the actual vaccine. In plain terms, getting natural chickenpox risks of pneumonia or brain infection, while the vaccine at worst can give you maybe a little bit of a rash. Now, the bottom line is that chickenpox was once considered an inevitable childhood illness, but thanks to vaccines, it's no longer, it doesn't need to be that way.
Yeah.
And by understanding both the science of varicella and the facts about vaccination, families can really protect themselves and their communities. So,
yeah, I don't know. I've seen shingles. I would never want to get shingles, and I would never want like my kid to have shingles or anything like that. And I hate it when my kid has just a cold.
Yeah.
It's like, why, if this exists for him not to have, then I'm gonna want to protect him against it.
yeah, exactly.
It's bewildering, but it's the world we live in.
It's the world we live in. We live in a very weird world.
Very weird. I have to agree with some people that are like, we really shifted into a really bad timeline after 2020. Like something happened in 2020 that we just derailed into a horrible timeline. And ever since then, things have just been like, what the? Like every day you wake up to something new to be like, what? Well, what? Really?
Yeah.
Like, we're doing this now. Okay.
Yeah, it's just more
Every day.
and more every day.
Every day there's
Just
something new. I'm like,
new.
we're really doing this now?
Yeah, there was a really famous doctor, like a creator doctor, and she was saying, like, announcing Europe, their like advancements, and then like Japan and their advancements, and then like the US, and it was like just completely awful. And she was just like this. She was like,
yeah. I think I did see something recently, that Japan had something major like come out recently. I can't remember for the life of me right now.
But so many new things.
But they
out.
really had a big advancement, and then we're just here like, people are not vaccinating.
Yeah, and like our own, I'm sorry, but like our own president. Did you see about all the things that he said like about vaccines? He's like you know, like a jar, just like a jar of liquid. You didn't see that?
No, I didn't see that. But my guy, you just got the shots.
To the doctors, break them up. Do it in 5 if you can. Now, it's inconvenient. It's inconvenient. Oh, you're going to have to go back another year later. You're going to go back each year for 4 years, 5 years, 3 years. Just break it up. Break it up. Because there's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it, it's like 80 different vaccines and beyond vaccines, and 80. Then you give that to a little kid. There's too much liquid. Too many different things are going into that baby at too big a number. You have a little fragile child, and you get a vat of 80 different vaccines, I guess, and pump so much stuff into those beautiful little babies. They're pumping, it looks like they're pumping into a horse.
This whole entire meeting was like,
The vaccine,
She forgot rubella.
the MMR,
he didn't know.
I think should
I
be
know.
taken separately.
that whole entire press briefing was,
Well,
well, there were like pediatricians that were kind of like, they had to take like 3 days to digest everything that they said. It's like ridiculous how many lies and crazy
yeah.
lies. You
Yeah.
know, like 80 vaccines.
my dude,
Split
where,
them
when?
up. You might have to go back in a year, 4 years, 3 years, 2 years. And I'm just like, where is he getting all of this information?
From his asshole.
Yeah.
Because nowhere
So
else.
weird. So weird.
It's, I don't
And
know.
you know, the other one that we don't talk about, which is the other one that we don't talk about is moms. There's going to be so many guys that are not going to be able to have kids. So many kids. Yeah.
No, we should talk
And
about that.
they're the ones that are like pushing like the fertility rate and like all these things that are dropping and all these things. And I'm like, but don't give them the mumps. Don't give them the mumps vaccine.
Did you see, like, I recently posted that on Threads
Yeah.
on like how much they're pushing for women to have now with the IVF,
Yeah, and now-
like lowering the cost. I'm like, my dude, why are you doing that? And then what happens after that? What happens to all the moms after that? You're taking away Medicare. You're taking away all these things. How the fuck are we going to pay for kids?
No, and RFK just was talking about like the fertility rate, but he was like making it seem that it's because we're like ingesting some toxin and that's why people aren't giving birth. And I'm like, no, my love. The reason why people aren't giving birth is because it is so expensive to
Yes.
have a kid.
Exactly.
And also people are trying to put their careers and wait for a better time when they make more money.
Again,
to have
because
a
of
kid.
that.
Yes, exactly.
Better the economy, and you're going to see how fertility rises.
And this is like Trump trying to push like for every like mom that has like a baby, they'll give you like $5,000, and I'm like $5,000. I was like, you'll blow through that on diapers.
Exactly.
Blow through that.
Have
on
you seen the
diapers.
price of daycare?
Yeah, exactly.
Like, you guys obviously don't live in the real world to know how much school and
But
just
they're slashing
daycare.
Medicaid. They're slashing Medicare. They're
SNAP
doing
benefits
SNAP
too.
benefits.
People are gonna lose it, like, I think next month already. A lot of SNAP benefits.
Yeah.
It's just, I don't understand. I don't understand. I don't understand anything. I really don't.
Yeah.
But anyway, yeah, hope this cleared up, hopefully, some questions maybe that you had on the varicella vaccine. Obviously, we're proponents for all vaccines. She's a pediatrician. If you didn't know, that's, I mean, come on.
We're not just like proponents for vaccines, we're proponents for science.
Exactly.
And we are trying to do the Lord's work in fighting the misinformation because
Yeah.
there's so much out there, and it's not about us being for vaccines. It's about us being for the truth
Yeah.
about public health and percentages and outcomes and not cherry picking data.
Exactly.
And so this
then
is all the
taking things
data,
out
you
of
know,
context.
exactly. And yes, we are for vaccines because
The science
the
proves it.
science proves it, right?
That's the only reason why. And I think that that's the only reason why you should consider an argument about it.
Yeah, and you could probably even cut this clip out too to like put it on our feed, but we put out the science
Yeah.
as it comes rolling out. And if you check out our autism episode, we talked about folate.
Exactly.
We talked about folate, and now folate is like this huge thing.
Yep.
Right?
Yep.
And in our autism episode, I actually remember talking about folate, and I was like, kind of like, oh, you know, like,
because I remember I had started seeing the news picking it up.
Yeah.
And then that's when I brought it over to you. I'm like, dude, have you heard of this? Like, this is the latest thing. And then now it's
like
even
blasted everywhere.
even more than when we did the episode.
Yep.
It's just, and that's the thing with science, and that's what a lot of people don't understand, and then they like to like cherry pick from it. It's like, yeah, but you didn't say that before. I'm like, science is the way that it is now because it evolves.
Yeah.
It's an ever evolving machine.
And also
you know?
like how you're interpreting the data too. Like
Super important.
Like on my Instagram that I talk about microplastics. Like I mentioned these studies, but again, like I mentioned in there, like more studies are needed because again, association is not causation.
100%.
Right? And that's how like science works. You like kind of like start picking up on things and things start evolving. It takes time for things to evolve. Right? But no, people just want like one line in one PDF.
And that's just not how it works.
And that's just not how it works.
It doesn't
because
work
everything
like that.
needs context.
Exactly. And a lot of always check your sources. That's one of the best things that I could say. in every episode that I have ever published out there of ours, I always list all the sources, and I make sure that they're accessible sources as well. You know, not ones that are hidden behind a paywall or you have to pay for the article or whatever. There's dozens of those, but I make sure that I get ones and I list them that you could access no matter what. They're free for you to just click on and you could open it. And they're always going to be listed in the video version of our episodes on all of them. Okay. Don't just look through social media, which again, like we had said in this episode, which is like one of the main places where misinformation is like really, really spreading hard. Make sure that whatever you're reading there and you're kind of like leaning into, check those sources.
Yeah.
And then even if those sources say like, oh, this is from the CDC or whatever, make sure that what you're reading is not taken out of context or is not misinterpreted by whoever published it.
Yeah.
Because medical literature is hard to understand sometimes.
It is hard.
It's hard.
Yeah.
There's a
It's
lot.
hard to write.
Yeah.
And it's hard to understand.
Medical jargon is it could be a whole language of its own.
Yeah.
So it's,
Even for me,
Yeah.
when I read papers, I have to go back and read papers. And actually, in residency, I'm not sure. I can only speak for my residency, but I imagine that this is across all boards. We have a day that it's just called, oh my God, like EBM, basically, like evidence-based medicine. And we have to come in with a paper. We need to identify what it is that they are studying, what kind of study it is, what does that actually mean. We have to interpret graphs. We have to do it. And I remember hating this day every single time because it is hard. And if you don't
Exactly.
really have a natural interest in it, then it's even harder. But I'm so thankful that I had the chance to learn how to interpret that because it is so important when it comes to interpreting data.
exactly. And that's why if it's hard for you that you're going actively through school for it.
Yeah.
Imagine people that have not.
And I took statistics and I took all these.
That's
I
okay.
took all these basic classes.
Yeah.
And still, for me, it is still hard.
It was so hard. So imagine for the everyday person out there that maybe some have maybe taken some science courses, and there's plenty that haven't even taken a simple biology course.
Yep.
And then yet they're here reading this. It's got to be hard.
Yeah.
For sure. I give it to you. But then accept that about yourself, that you may not be understanding fully what you're reading.
Yeah.
And then don't put it out there as a fact.
Yeah.
That's the problem. And that's like a lot of this misinformation is being propelled by that, by people taking things out of context, not understanding what they're reading, then being fueled by fear because of other people like, oh my God, that sounds so scary, or that looks so scary, or this and that.
And then that's what results.
Yeah. So just make sure that you're reading things from adequate sources and that they're not taken out of context as they love to freaking do, because then it's like, oh, look, but the CDC said it. It's like,
Keep reading. Just scroll down.
that was like in the middle of a paragraph.
Yeah,
Did
exactly.
did you like read
Did you read the
before?
paragraph?
Like, yeah. Did you read the whole thing? Anyway, yeah. So that was Varicella.
Yeah.
It's a nasty bug. Yeah. I'm sure if you've had it or anything like that, any experience on it, let us
so
know.
funny because people that have like hand, foot, mouth, like the parents literally look at me with these eyes like this and they're like, this is the most disgusting virus. And then I just like think about it and I'm like, yeah, so is varicella.
Yeah.
Varicella's very similar.
Yeah.
Very
And
similar.
I'm telling you right now, I've been through hand, foot, and mouth. And if there were a vaccine tomorrow on it, for me never to get that shit again,
Yeah.
I'll be the first one in line. That sucked.
Yeah.
Like and then seeing my kid going through it, that he doesn't want to eat or anything, and then all these, hell no. Give me the freaking shot when it's available now. Like, I hate that. Like, absolutely not. But anyway, thanks for tuning in. Subscribe, comment, all the things. You can find us on all forms of social media, our podcast and our personal ones. If you find us on our podcast, you can find our personal ones everywhere. We're here every Tuesday. If you hear us on audio, check us out on YouTube and vice versa and all the things. And thank you guys. We appreciate you all. And we'll see you on the next one on next Tuesday. Bye.